when we were sitting at the Capitol and we had asked families to come and testify, it's one thing to go to a support group and it's one thing to have incredible friends and to know their stories, but it's another one to sit there and to watch family after family after family go up and testify.
All right. Thank you for joining us today at Family Care Learning Podcast. My name is Shelley Utsky, and I'm the Foster Care Program Manager here at Christian Family Care. And today we have a privilege of talking to Anika. I'm going to really slaughter this name. I told you that. Robinson, who is one of the people instrumental in what we now know as Jacob's Law, and also one of the founders of Advocacy, Support, and Assistance Now, which is ASA Now. So just if you could introduce yourself to us here and we will get on with some questions.
Absolutely. So my name is Anika Robinson. I am a mother and wife. I have 4 biological, 4 adopted, and currently foster up to 4 kiddos, ages 0 to 17, boy or girl. And I'm the president of ASA Now, and I love what I do.
Wonderful. I was just so excited when I found out that you were going to be the one that I could interview today because I am a foster and adoptive mom as well. And so it's like you hear about all of these things and these resources that we have, but a lot of times we don't know how we got there. Mm-hmm. So can you just tell us a little bit about Jacob's Law, kind of what prompted your involvement in that, and then just kind of tell us how it all came out? I know it's probably a long story, but shortened.
Yep. So great question. So how it came about was 9 years of experiencing a very broken system where children were placed in my home. I was not educated on how to navigate the system, our child welfare system, our behavioral health system, our medical system. Basically, it's like asking a paramedic to go out and help an injured person without having the medical training behind it. So I felt after 9 years of fostering, and I have been fostering 13 now, so I did not quit, but I felt like quitting year 9 because I was waiting upwards of 9 months to a year for my kiddos to receive services. And it was a particular Saturday where I very much felt like all that I was doing was housing them. They had such high needs, and I just really felt like I was not therapeutically trained. I was not a clinician. So really it was born out of that sheer desperation of we need something different and we need something better and we must do better for them.
Okay. Very good. And you partnered with some other foster moms, right?
I did. So you are Christian Family Care. And so I will say that night, originally, when I signed up to be a foster parent, I told God I was going to volunteer to be a middle mama for a year. And so that evening I went in prayer and I said, Heavenly Father, please release me from this calling. I don't want to do it anymore. And God knew that I wasn't a quitter, and I'm pretty sure that he saved some special souls up there to be advocates because it is not easy. And instead woke me up at 3 a.m. and said, start writing. And I wrote down solutions to not only the barriers that I had faced as a foster parent, but also the ones of my very dear friends who, you know, through support group, through crisis, you get to hear all of their barriers. And so really, that information that was downloaded was written there. And I reached out to Access. I reached out to our child welfare department, to our rebus. And at the time, we had over 19,000 kids in care. And there were only 2 grievances that had been filed. And so they felt like, hey, we're doing great, right? There's 19,000 kids in care, only 2 grievances filed. Everybody must be getting services. From the outside looking in, I can see that perception. And so because they felt like there was no issues, I decided to Google who our legislators were, decided to become politically involved, reached out to them, and asked if they would, meet with us. I also met with Angela. I had met her through support group and asked if she would be willing to. I really felt like we needed to be a team of 3. If she would join me, she thought I was crazy, but she said yes. And then Susan, I had met through a trauma mama retreat, and she said absolutely. And the 3 of us had 27 kids at the time together. So if you can imagine even trying to get childcare. Because people don't realize this, but we started in October. It was finalized. It was exactly 5 years tomorrow that it was signed by the governor. But from October through March, full time of living down at the Capitol Monday through Thursday, from sunup to sundown. Sometimes we were there legislatively until like 10:30 o'clock at night, and then starting and doing it all over again. So it was sheer just grace of God that everything came together and that people stepped up to watch all of our kids. So it was not easy. But that's how Jacob's Law was kind of started, was meeting with our legislators and asking them to sponsor the bill.
Wow. It was really God telling you this is what you needed. It wasn't something you wanted, but it was something that you knew that's what God wanted you to do. And the fact that you took action
yes,
and you got those other supports is just amazing.
Yeah.
So Jacob's Law, 5 years from
tomorrow.
Yeah. Wow. And so what exactly, for everyone that's listening, what does Jacob's Law do for foster parents and for our foster kids?
Sure. So Jacob's Law, most people believe that it's only behavioral health services that are covered. But again, Jacob's Law is over 27 laws that were part of it. So at the beginning, the 3 initial ones that were being sponsored were all having to do with behavioral health, but we continued to meet with legislators until someone would run the entirety of the bill that we had. And then we were able to merge those 2 together when we went before our first committee. And so it really covers a lot. So I will say it covers Title 19 and 21. Okay. If people don't know what that means, it means your foster and your foster adoptive kiddos, which is your Title 19. And if you yourself, if you're watching this, have children that are on kids care, so Access Kids Care, it also covers those Title 21. So it's not just for foster, it's not just for adoptive, it's also for anyone who is on kids care, so children in care. Prior to Jacob's Law being written, the max time that a provider had to see your child was 23 days. And that's through federal law, but no one ever had told us that. So we made it possible. So Jacob's Law, in a nutshell, it makes it to where immediately, as soon as a child comes into foster care, a placement packet has to be provided. That is critical information. If there's allergies, if a child has medications that they're allergic to, if they've been maybe removed from another placement because they perpetrated, or maybe they have, a G-tube or J-tube or whatever that might be. It's really pertinent, critical information, even down to if a child who is removed, maybe their parents didn't vaccinate and didn't want them vaccinated. One of the things we typically do is take them to the doctor. If they're not, then they'll vaccinate. So it's a complete placement packet with information for their behavioral health, their medical, their if they've had vaccines. It also shows the information for the DCS specialist. So many kids were getting dropped off and said like, oh, we'll get you that information later. And then they were in crisis and they had no CMDP information. They had no access to DCS. So very short, it encompasses everything that you need to be successful and to make a good decision as to whether you want to bring in that child into your home or not. Maybe if something scary happened, then you can put safety parameters around it. But it mandates that they provide it immediately, so I don't let them leave my home unless they have a placement packet, or I follow them to their office and get it. It also mandates that previous to Jacob's Law, I'll give you one example. Our foster child had been with us probably about 6 months. DCS had not come. Obviously, the referral had not been done for rapid response. I literally had to Google, and I spent like an entire day before I could find a phone number to rapid response. And I called them and I said, I've had this child. She's developmentally behind, because not only is it for behavioral, but they're also looking for any other issues. Sure. And I said, can you just come out? No, we cannot. We have to have a fax. Referral. And I just said, like, how is this possible, right? Mm-hmm. Like, how is it possible that I can't refer? So it makes it to where now you can self-refer and have them come out. And it's within 72 hours or sooner based on necessity. So obviously, we're not going to wait 72 hours if the child is in crisis, because again, they were just removed. It might be a very traumatizing situation. I had a friend that had a teenager show up at 14 years old only wearing her underwear. That is heartbreaking. So obviously, it's all based on level of need. And so if a parent identifies somebody needs to be here right away, trained clinician, they can call and self-refer. Then to get into do an evaluation at a behavioral health agency, it has to happen within 7 calendar days, calendar being the key word. Or you don't even have to have a rapid response. So maybe you just want to self-refer to the agency, then you can do that as well, which again, it's based on necessity. So sooner mandates 24 hours if it's an urgent need. And then any time frame that's identified. So during that initial evaluation, so you get into the behavioral health agency, they assess, they decide, okay, maybe they need a behavior coach and trauma therapy or EMDR, whatever that might be, has to happen within 21 calendar days. And it's not, yep, we're going to identify this need and then we're going to meet again and then meet again, and then it'll happen 4 months later, right? No, it has to happen within 21 days of that initial evaluation. So I have a lot of families that say, well, they met with us and then they said they needed like a follow-up in 2 weeks. And then after that, like another month. And so then they're told, like, as long as we meet again within 21 days. No, it's that service must be initiated within 21 days from that original evaluation. From there, we made it possible to where if a child is in crisis response is being unresponsive. A lot of times it was like a kid in crisis and 5-6 hours later, no one has shown up. Made it mandated where they have to be in your home within 2 hours. If they're not in your home within 2 hours, Jacob's Law mandated that a children's liaison position be created within each one of the health plans so that they could take 24-hour calls from foster adoptive families. So then you would call them if they haven't come to your home, and then they have the ability to dispatch. It made it possible that if your child ends up maybe in a hospital, and I know this is really scary to talk about as a foster parent, your child may be ending up in a psych unit, but if an out-of-home request is needed and that child is in the hospital, they can no longer be discharged unless they're somewhere safe and appropriate for them to go. So there was nothing worse than a child being there and they had filled out that request, and now we mandated that it happen within 72 hours that they respond, where because they were no longer medically necessary to be at the hospital, you had to take them home. But think of maybe a child who perpetrated or who wasn't safe returning. If the family said, no, I can't bring them back, they would then be charged with abandonment, abuse, or neglect, right? But yet, if they brought that child home, then they were facing allegations of now risking the life of the other children. And so you really couldn't win. So it doesn't mean that there can't be an allegation. So let's make that clear. It says you cannot be charged, right? Mm-hmm. Because an allegation can always happen if someone is not aware of this law. Mm-hmm. However, when you do go before the judge, then you're able to say, this law pertains to me because of my child's high needs. And so now they're covered and no longer can be charged. So that was a big component. Now, as a foster parent, I live in Gilbert. Often we would get kiddos from Casa Grande, from Florence, and guess where I had to drive them to therapy? There, because that was where they were removed from, and that's where their REBA, which is the Regional Behavioral Health Authority, fell under. And so we gave families the option to choose whether they wanted to go there or they wanted to use someone within their own community, right? So sometimes it's not feasible for family to drive an hour and a half to wherever the child was removed from. So we cut through that red tape. We also made it possible for families, if that 21-day expires for behavioral health services, to be able to go out and use their own provider, and that provider is reimbursed at 130% of the fee-for-service rate. So that means if the health plan didn't have enough providers, then I now have the ability to use any AHCCCCS registered provider, which is there's 66,000 of them out there. And I don't have to wait 3, 4, 5 months or 10 months or a year. I can get them services right away. And the sanction for the health plan is that therapist is now reimbursed at 130% because they were not able to provide that service within 21 days. We also put in that anytime a family needs that service, they have to file a grievance. They have to email Access and CC the health plan. And so you'll have like one-pagers that have each of the health plan's emails. So DCS at asaccess.gov is the one for Access. And then depending on your child's health plan, it'll have their DCS at, or it might be a little bit of a different email, but I always say do so in writing. And then you can say 21-day timeline has expired, day 22, and here's the therapist I'm choosing to use. And then we also, last but not least, made it possible to where if a CFT occurs, how many times as a foster parent I showed up, DCS didn't, and they had to reschedule. So now we have the ability to go, and the CFT can still occur even if DCS is not present. And the added bonus is we now can sign off on behavioral health services where before we couldn't. We had to wait for DCS. And then anytime a grievance is filed through Access, they have to report all of those grievances to the legislation on a yearly basis to show where they're at as far as getting those timely services. And there can be sanctions for the health plans for not having enough providers, because obviously when they contract with AHCCCS, they're saying we will have enough providers to meet the needs of our children. So I always encourage families, 1, be an advocate, 2, make sure you file your grievances day 22 to ensure that the kids are getting the services that they're entitled to receive. And 3 is just a reminder, like we've gone through 2 huge lawsuits, one in 2001, one in 2015, both of them on behalf of foster children. DCS just settled in February, and they have until 2025 to show that foster children are receiving timely behavioral health services. But I always remind people, it is our job to advocate for them. It is our job to ensure that they're getting those timely services. And the one caveat added, even though this wasn't part of Jacob's Law, is for a lot of our kids, they have medical needs. They suffer adverse childhood experiences, and obviously their little bodies, it shows. So for anyone who might have a kiddo who has medical needs, the most you can wait is 45 days, and that's based on AHCCCS policy for that specialty provider. So even if your kiddo needs a neuropsych and you're told we don't have anybody for a year out, file your grievance. You will get someone within 3 weeks. Same thing for your medical specialty providers. If you're a foster parent, make sure that you file those grievances to ensure that they get those timely medical needs. And then Jacob's Law also covered that if a child was returned back home and then they came back into care, that you received a call. So even if you've closed your license, you get to be first choice if you were that last placement. So there's a lot. I always encourage people, just go in and read that chaptered version. It's all in blue, all of those highlighted sections. And that is like the most critical component. I feel like if I had been given that little, like here's Jacob's Law, that little packet when I first started, I would have known what to do. I would have known how to advocate. I would have known where to turn to when I was told it's a year. We don't have anybody.
Yep. No, that's such great information. And it basically was empowering. It's empowering for foster parents, but they have the power now, but they don't necessarily know they have it.
Right.
So it's kind of like what you were saying. We hear Jacob's Law, we automatically think behavioral health services, but it is a whole lot more. And,
it does.
And the days and the times, I always have to look like, how many days do I have now?
Right.
Or that kind of thing, to keep on top of that, because it's really difficult to keep that straight, because it is different for regular physician type situations versus, behavioral
Medicaid.
health. Yeah. Mm-hmm.
And as far as the timelines, I always tell people, like, you don't have to wait until that 22 days expires. If you want to be proactive and email the health plan, Mercy Care, the children's liaison, saying, hey,
giving you a heads
there's
up.
been a referral for, let's just say, I don't know, EMDR. I need to make sure my child gets in within 3 weeks. Like, they are on top of it. That's what they've now been hired to do, thanks to Jacob's Law, is to advocate for kids in care. So make sure you're utilizing them. And then this wasn't part of Jacob's Law, but after passing Jacob's Law, I was asked to come and work for AHCCCS. So I had given them feedback when they were signing the law that we needed a foster care community liaison position. Veterans have it, SMI population have it. Like, why don't we have that? And there was, again, close to 20,000 kids. So they created that position. They asked me to come along. I really advocated to have a dedicated foster care hotline as a preventative, because I couldn't understand why we were waiting for crisis to occur before we would call a crisis response, right? Like, why can't we have a number where families, like, hey, my kid's completely dysregulated, I don't know what to do. Or I'm completely dysregulated, I don't know what to do. Or they just dropped off 4 kids and, they're going through so much. They are there to assist them telephonically. They can come to the home. So I always advocate for families, like, keep that dedicated foster care hotline on your phone. If you're at the park and they're completely dysregulated, or they're in the car throwing car seats, like, utilize them. That's what they're there for. So I do love that aspect as well. So I feel like we have so much more now than we ever did, but it's helping families navigate and learn how to utilize it and how to advocate. And the health plan, which is Mercy Care, I'm sure that most people are aware by now that it's going to be integrated care come April 1st. They have a DSP. So they have a specialty provider directory. I was never privy to that as a foster parent. And I'm like, why? If I'm able to look at every single specialty that's out there, if I'm able to, like, hey, this looks like this would be the right fit for my child because they happen to be in my home 24/7. why not allow us to see what is there that we might feel is the best option? So I always tell families, Google it, Mercy Care DSP, directory, specialty provider directory, and look at all of their wraparound services, equine therapy, whatever service you're looking for.
Variety of
and
services.
look at that, and then bring that forward to the team at your CFT. And then I always advocate for families to get a copy of their service plan before they sign it. Okay. And then keep it, because one, if your child ends up in the hospital, maybe you put it all in your Google Drive, you're able to show it to them. 2, it shows you the progress that has been made. Or 3, hey, it's been 4 months and we've had this therapy and it's not working. So let's try something new so we don't have to wait a year or 2. And if you do have to file a grievance, I always say attach the service plan so that you're able to show Access, hey, this is when it was filed and this is when it was added. I've had families when I worked for Access that they filed a grievance, and then when they requested from the behavioral health agency, that service wasn't there. Even though the team talked about it, it was all there, but unless it's there, they can't hold them to it, right? It's a contract. So always, 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 I'm like, even if they give you the little pad, I read it first, take a screenshot with my phone, right? So it's here. And then I always say, email it to me. Yeah. And then once you email it to me, I'll sign it. So if they don't have a paper copy because their supervisor has to read it, that's a little golden nugget. I call those golden nuggets. Save that golden nugget.
Yeah.
Yes.
Cool. Great hints, great ideas to kind of keep everyone accountable that's on the team, because it is a team that you're working together. And so it's them knowing your stuff too.
Yes. Yes.
I'm sure that when they see you coming, they know, we got to make sure to give her that service plan.
It's been 5 years. They don't know who I am, but I love that I'm able to sit there with a brand new foster child who needs service and advocate for them and be like, hey, and
Sure.
So I'm glad that I know how to navigate the system, not only our child serving system, but also our, access system.
Okay, so that was a huge amount of information.
It's a lot.
It's a lot. So that wasn't enough. You decided to start ASA Now, right?
I did.
So tell us a little bit about that.
Yeah.
I know I've looked at a couple of things. I'm not extremely familiar. I know you have a site and a school and just a lot of different things. So tell us how that all came to be as well.
I remember as a foster parent driving home late at night with a brand new placement, and I had nothing for them. And when you just dream, I always say, I dream really big. And at the time, it was just a dream. Wouldn't it be incredible to have a place? Because again, we don't get kids' plays Monday through Friday, 8 to 5, right? Wouldn't it be incredible to have a place where if families needed whatever items, middle of the night, formula, diapers, wipes, clothing, underwear, socks, that you can go and you can obtain it. A one-stop shop for everyone, so where everything could be provided. And when we were sitting at the Capitol and we had to ask families to come and testify, it's one thing to go to support group and it's one thing to have incredible friends and to know their stories, but it's another one to sit there and to watch family after family after family go up and testify to the brokenness of the system. And so many of them closing their license because they didn't feel supported, or they didn't know how to advocate for them, or a child was removed and they weren't aware that they could file a 24-hour notice to stop that removal. I mean, there was just so much brokenness in hearing those. The day that the governor signed it, because I had an emergency clause, I got on my knees and I said, thank you, God. This was all you. I honestly felt relieved and thought my life would go back to normal. No more late nights, 2-3 hours sleep. And God said, you're not done. And that vision of what I had imagined long ago came forward. And I had talked about it support group, and most people were like, oh man, you're crazy. And I said, I want it to be volunteer run, the community stepping up to care for these kids, not just us, because they're not just DCS's responsibility. They're our community's responsibility. And I was like, I have zero experience, right? But yet again, here's everything we were able to accomplish. So if that's what God wants me to do, then that's what I'm going to do. looked up, how do I start a nonprofit, right? I went and said, hey, I think we're not done. You guys want to join me again on another adventure? And they looked at me, and I love their hearts, right? I mean, here we are with all these kids, and a lot of them with acute needs. So Jacob's Law was named after Susan's son.
Okay.
And it wasn't just for him, but so many of the other 19,000 kids that represented him from a broken system where he couldn't get timely behavioral health services and ended up living outside of the home. So, we have kids with high needs, and we just thought, we got to do this. So 2 months after we signed it, it took us that long to learn and to Google and go to YouTube and
no vacation,
what
apparently.
we do. We took one small vacation, yes.
Okay.
And came right back and started the nonprofit, and started out with support groups and doing monthly family socials so families could get to know each other and be a natural support system for each other and trade respite with each other. Then I wanted foster children fall behind educationally. About 30, I want to say maybe 36%, don't quote me, graduate from high school. Only 3% go on to graduate from college. So statistics are very low. Every single time there's a move, they fall behind educationally about 6 months. And then how do you learn when you were just removed? And all you're thinking about is the trauma, right? And yet day 1, day 2, day 3, you're put right back into a regular classroom. So I wanted a space where for those kids who are educationally behind, we could come together. Again, I didn't have a facility, so my dining room became our tutoring room, thanks to interns and volunteers. My garage and my spare bedrooms became my giving closet. So I was all hours of the night filling immediate needs bags and putting them out on my porch, and families would swing by and pick those up. For those, especially the kinship families who needed food boxes, a lot of times the barriers to saying yes was, I had no clothes, I had no beds, I had no sheets, I had no food. How am I going to, I'm on a limited income, maybe they make minimum wage. How am I going to afford taking on 2-3 kids? So I just thought food boxes, like why not supplement and offset that cost? So we were having people do drives, and we were doing them out of my kitchen in my backyard and getting those out as quickly as the request came in. From there, I thought, okay, there needs to be more. So then it was extracurricular activities and life skills. And we started doing what we call trauma mama retreats. So they're really good, where you can take these moms who have really kids with high acute needs, and you can leave for 5 days. We go to Rocky Point, by the way.
Oh, wow.
And we are in paradise for 5 days, and then identified we need couples retreat because couples need to reconnect. Yeah. So we hold those, which ours is next month in April 23rd. And so we invite couples to come down with us. Again, Mexico this time, Pine Top last year. And then we have family holiday events. So for those who maybe can't afford Christmas, we do birthday requests 24/7. So even a kiddo got pulled, it's their birthday, we fill that request. We do food boxes out of our pantry. We do food distribution every week. So we pick up from Midwest, Trader Joe's, Safeway, and those go out every single week. We do after school tutoring. We do art, karate, dance, cooking, musical theater, guitar, piano, cooking, life skills. But all of those are twofold, because my junior senior was tutoring, making $20 an hour when she was in high school. So the kids who are coming are learning how to tutor. They're learning maybe guitar. You can teach that from your dorm when you age out. They are learning how to budget and eat on a $25 a week budget. They're learning how to use a commercial kitchen so they can leave and go get a job at a cafe, at a restaurant, knowing how to use the equipment, how to sanitize properly. Maybe they're doing dance or karate. Again, it's a twofold. One, it's giving them something to come into that community center, to be happy about, to get excited about, to connect with a community member. And then when they age out, they have something to fall back on. So it's really that twofold. And then we follow them all the way to age 26. So just because you graduated our program doesn't mean that you're aged out, goodbye. So we were able to provide a car for a kiddo who needed a car to get to school and to her employment. We still provide them with those weekly food boxes, clothing, furniture that they might need to be successful, anything and everything. So we were able, I want to say maybe 2.5 years into our nonprofit, to purchase a $1 million property in Mesa. It was not a good place. It completely needed to be renovated. We didn't have any money. I couldn't get anybody to lend me, not even a bank, like 30 grand, right? Baby nonprofit organization. As fast as the money was coming in, it was getting put right out. So I prayed and I said, God, I'm going to leave it up to you. If you want this to happen, it's all you. And sure enough, like, had someone call up and I love your mission, love what you're doing. I will lend you $1 million. You just got to pay me back in 3 years. Had no idea how I was going to make that happen. Balloon payment, mortgage payment.
But I'll take the money.
But I'll take the money, bought the property, took us 1.5 years to renovate it. While we were renovating, again, our youth were amazing. Life skills, trenching, cutting, floors, stage, the whole shebang. Someone came in and saw us working and they said, we're going to pay off your building so you never have to worry about a mortgage payment.
Wow.
Just beautiful. Again, it's all God, right? It's nothing me. 3 acres. And then the back acre allows us to develop. So I wanted to have a basketball court and a playground and a pool to do aqua therapy and a school, trauma-informed school, and equine for the kids. And I don't want to bill anybody. I just wanted them to receive it. And so it was the perfect space where I saw everything that God wanted us to do. And with it being paid off, it's great because we don't have a mortgage and we run on donations. People are like, do you do grants? No, we don't. Like, do you get any state funding? No, we don't. It is honestly like just the generosity of our community who are able to use the foster care tax credit. And as soon as the money comes in, I mean, it is put right out. So last year, we served over 11,000 kids, over 3,000 families, and we distributed over $430,000 worth of product.
Amazing.
Yeah. I mean, when I say those out loud, I'm like,
yeah, you have to say it out loud to make it be like that.
It doesn't
real.
even feel realistic. I will honestly say that. But it's that beauty of a community stepping up who volunteers every day to serve our kids. And we don't just serve foster, right? We say, if you've got an adopted kiddo, their trauma didn't go away when this judge signed it. So we serve the entire family, including their siblings, right? So if you need a parents' night out, because we hold those monthly, we are there for all of your kids. So you can go and connect with your husband or your spouse or significant other. We do monthly trainings for, they're all online, so families are able to log on or do it in person. For some of those, we provide childcare as well, and dinner if they need a break. Jacob's Law trainings, all of those. So if anybody is in need of a break or a family, we have family movie night this Saturday, right? An outdoor one. You want to be involved. You want to get to meet an incredible community that is like this. And I literally, they are my village. Just go to asanow.org and we'd be happy to serve you. And we have a 24/7 number. So we're on call 24/7. So if you're at a CFT and you have a question or you're driving somewhere, you're like, I don't remember this, just call us.
Okay, perfect. So is there any contact information other than just visiting the website? Do you have that phone number that they could call?
Yeah, 623-428-1592. And then our website, asanow.org. And we're also, I think most everybody follows us on Facebook and they're able to ask questions there, interact. We post everything. So all of our events are always posted under our events tab. It's very easy to kind of navigate. It breaks it down, let us help you. So ASA Now would be all of the immediate needs. So if you've got kiddo who just came in and you need clothing, underwear, socks, shoes, playpen, car seats, I don't know, whatever you need, you can fill it out right there. If you want to do a workshop or a training or a retreat or a family event, it's all on there. And then the next tab is Jacob's Mission Community Center, which is our after school program and our extracurricular activities. And then Shade Tree Academy is there. Because I always say, if I put it out there, then God's going to make it happen. I just got to come up with $5 million to build a school. So if anyone out there feels really generous, I put it out into space and I expect whenever God wants it to happen, it'll happen.
Yeah.
Right.
Perfect. Yes. Perfect. I just so have enjoyed our conversation. There's so many different aspects of all of this that it's hard to just keep it all in one capsule, so to speak. So it's nice that you were able to unwrap it for us because it's been kind of your your baby, for lack of a better term.
It is totally our baby.
Yeah, I was going to
Yes.
say, so it's great to see that. And I think that also speaks to foster families not knowing what's really available to. And sometimes, like you said, they're in that mode of, I have this new child, I have no idea what we're going to, what did we sign up for? You get all of that, but there's places out there that are willing to help, like
Absolutely.
ASA Now. And
yeah. And then for anyone, we very much just kind of brushed over each of those things.
Sure.
And again, Jacob's Law is so much more than just behavioral health timelines. So we offer that Jacob's Law training. It's a full 3 hours.
Okay.
So it does go over that scope of the placement packet, everything that should be in there, all those pertinent information. Then it talks about timelines and other rights and protections for both the children and the foster families. A lot of families are not aware of what their rights are, what to ask for, including getting medical records, their behavioral health records. And then if for some reason, like a child's not doing well in their home, under the foster children's Bill of Rights, it also states that the foster family has the ability to ask for the DCS records. And so there's so much out there that families can still learn. And I always say, take it a couple times almost, because, I have families that are like, I took it a year ago and I already forgot. Like I had one today comment, their timelines had expired and they're like, how have I forgotten already? And I was like, hey, there's a training coming up Thursday. There you go. So we offer them in the morning, we offer them in the evening, and that way we kind of hit both, groups of whoever needs it. And it just changes. So 1 month it'll be in the morning, 1 month it'll be in the evening. And and again, our trainings, our support groups, our therapist that donates her time, she's what we call the rad whisperer. So for anybody with high acute needs or attachment disorder, she's amazing. And then we have another one who also donates her time, and she receives feedback based on the community, what do they need to hear. Okay. So this month it was for those families who have had an investigation and were maybe traumatized, suffering secondary PTSD, or just knowing how do I let go of all of that. Sure. And so that's what will be covered. So again, amazing CPR, first aid, we offer all of those at the community center. We also partner with sister organizations. So maybe there's a kinship family that comes in and they need everything from beds to linens to first aid kits to fire extinguishers. We have car seats. We are able to really pretty much, if we don't have it at our facility, we can find you someone that does. And then our website also has resources. So other resources out there in the community that provide services. So maybe you're in the West Valley or Tucson or Flagstaff. Every, as far as I know, foster agency that's out there for supporting the foster families is listed there, at least the ones that I know of. Okay. So feel free to navigate if you are outside of the Maricopa County. And then I've had families say, for example, we just had one I live in the West Valley, I don't have transportation. We are friends with so many realtors that come and volunteer with us that they're always driving all over Arizona, right? I will find somebody to drive it for you. So even if you're you don't live close to me, but I need clothing or I need food, we have amazing community volunteers that will drive out to your home. This last week, we had someone that drove it out, and actually 2 other families met there who also needed items. And so I'm don't ever stop from asking. So, and even if the answer is, I don't know, I will find you someone that knows the answer, because I don't know it all. But I know people that know it all. So
good.
We don't have to know it all. So if they need anything, just reach out.
Okay. So appreciate our time together. And we're going to just kind of wrap it up here. We appreciate your insight, obviously, that you can get it from a different perspective than what we get it from the outside. So it's nice to hear from the founder of these things, Jacob's Law and ASA Now, to kind of understand that there was the motivation behind it. And here at CFC, we do look at foster care as a ministry. And that's really what you've been showing us through this whole conversation, is all of these things where God directed you to do and you did them. You heard the call. Yes. So we just appreciate all the time that you've put into Jacob's Law and ASA Now, and even our time here. So I want to thank you so much.
Absolutely.